So good morning and welcome. My name is Jennifer Tremmel. I'm an interventional cardiologist here at Stanford and also run our Women's Heart Health program. And we are thrilled to be having this event today and are so glad that all of you are here. We hope that you find this an educational day as well as hopefully heartwarming in a lot of respects. I know we have people from even different states that have come here. I know there are people out there that feel quite alone, and if there's any indication that you're not, it would be here in this room. We're so pleased to host this first SCAD event at Stanford, an event we hope will become an annual event, so we'll see how things go. So I did want to give you a little introduction to what we do at Stanford. So the Women's Heart Health program was started in 2007, and I started it with Mary Najedli, nurse practitioner who's here with us, and it was just the two of us. And the Women's Heart Health program grew over the years, certainly. We added Abha Khandelwal, who is a non-invasive cardiologist, Sandra Sai, a preventive cardiologist, Sahar Naderi, non-invasive cardiologist who subsequently went to Kaiser, and we miss her, but she is here today because we all have shared interests in taking care of our women and some men patients here today. We also have two psychologists in our Women's Heart Health program who you will meet. So Katie Edwards and Valerie Hoover are part of the program, and then several nurse practitioners who are integral as well. So Katie Janicek and Aaron Bryant, and they're here today too. So it's a large program that's grown. We work very well and cohesively together, and hopefully to provide the best care for our patients that we can. I would say that two of the biggest questions that we get for people coming in is, why do I have chest pain, or why did I have a heart attack? And I think for this group in particular, the why did I have a heart attack is a big question, because we usually think of people having heart attacks as, not eating well and being overweight and having high blood pressure and all of these things. And for most of the women and men in this room, that was not you, and you had a heart attack, and you may have been in a situation where even the people taking care of you didn't understand what was going on. So SCAD is certainly an area where we have learned a lot, but we also have a lot to learn. And part of today is also going to be about sharing about, what don't we know, and where should we be putting our efforts in order to learn more and hopefully make it so that our patients feel that they're being well taken care of and that we're ultimately trying to figure out what's going on with them. So you will find, so you all have an agenda in front of you. You will find that we have a stellar lineup of speakers. You couldn't be in a better place to learn more about the cutting edge of SCAD. And we are very fortunate to have world experts that have joined us today. You'll hear from Dr. Sharon Hayes, you'll hear from Dr. Jackie Saw, you'll hear from Dr. Esther Kim. These are the people in North America who know the most about SCAD. So it's going to be a great forum, I think, for really finding out what's going on. So we have a lot of people to thank for today. I wanted to start with, this was all started by a patient who said, gosh, it would be nice if you had an event. So one of our patients, Becky, went to Dr. Naderi and said, is there any way Stanford could host an event so that people could learn more and also meet other people? There could be some networking and feeling of camaraderie there. And so that really kind of started this whole thing. Can we put on an event and do this? We have to thank certainly our marketing and events people who made this possible in this beautiful venue for us. So Sheila and Krithika and Nikki and all the others who have put in great effort to make today possible. And then I wanted to thank Abha Khandelwal in particular. So in the leaving of Dr. Naderi to Kaiser, and then me actually going on sabbatical a month ago, Dr. Khandelwal really took charge of putting this event together. So So without her, we certainly wouldn't have been able to get this done. And we wanted to certainly thank all of you for coming. And I think just by the showing of people in the room, it does tell us that there is a need for this out there. And certainly as you go along today, if there's things that come up that you feel like you didn't get or you'd like to see again, we certainly would like your feedback. And this whole thing actually was also made possible by a patient who gave us money to do this, so a philanthropic patient. And so we actually really owe a lot to her as well, because it does take funds to put on an event like this, and without that, we wouldn't have been able to do this either. So I certainly thank all of the people who have made this possible. So if you look at your agenda, at least we'll kind of I'll give you a little outline of the morning, and then when we get to the lunchtime, we'll give an outline of the afternoon. But we're gonna have a couple of speakers, we'll take a break, another speaker, and then we're gonna bring our speakers up so that we can do some Q&A. And the way we wanna do it is that if you have questions, we'd like you to write them on your pads of paper. And we're going to collect them and then try to answer those questions. And we may modify them a little if 3 people have similar questions and that sort of thing for efficiency. So as you get a question in your brain, write it on your piece of paper. At the break, you can put your papers on the back table. And as the speaker after the break goes, if you have some more questions you want to get in before the panel, raise your hand and our helpers will come and pick up your questions. And so hopefully we'll get everybody's questions answered. After that, we have another talk, and then we're gonna have breakout sessions. And so one group's gonna be in here, and then we have a couple other rooms, and we'll try to get everybody to the right place for these breakout sessions. And people have signed up where they want to go. And in those sessions, we're actually going to be interacting. We'll be meeting each other. We'll be talking about what is out there, what is not out there, what do we want. And we'll come back and then we'll hear from each group of kind of what they came up with in terms of how we could be doing better. And then we'll go to lunch, and then we'll get oriented for the afternoon. I think the weather's starting to improve. I apologize for the rain, although it's not my fault, I don't think. It's actually great that we got rain. It just was not the best timing. But I think that maybe by this afternoon we'll be able to be outside a little bit, and I think tomorrow should be nice as well. So hopefully that will get better. And then there are some basic housekeeping things. Also, I think you guys all know the bathrooms are just right outside to the right. If you have cell phones on, if you could please make sure that those are on vibrate or silence. So we are videotaping this so that it will be available to people that either want to watch it again or maybe weren't able to attend. So we kind of want to make it so that there aren't odd noises and that sort of thing going on. All right, so I think that was basically the introduction that I wanted to give. So I'm going to try to keep us on time as much as we can, and I'm going to start then by introducing our keynote speaker, Dr. Sharon Hayes. I think probably everybody in the room has heard of Dr. Hayes, certainly a world expert on SCAD and somebody who's been in this arena since the beginning. And so I thought a very appropriate person to kind of tell us the story of SCAD and how far have we come and what were things like and have we made any progress. So we're very glad to have Dr. Sharon Hayes here from the Mayo Clinic.